So today we're going to talk about occupational therapy as first contact roles, and especially in the additional roles reimbursement scheme. So my name is Desi Gillespie. I'm fortunate to be one of the NATH Allied Health Professional R's ambassadors. I'm a clinical first contact physio and an OT clinical lead within PICS in Nottinghamshire. So the reason that we're doing it this week, so the Royal College of OTs have OT week every year. So every year is a different theme. This year is about what occupation means and why does it matter. So that's where at Nottinghamshire Alliance Training Hub at NATH, we'd like to celebrate the occupational therapists we have across the county and about what they do in the population from all their different roles. So please have a look at our social media. We've been sharing about the different roles, how to get into the roles a little bit more, and then obviously there's opportunities to ask more questions from what we've learned. So today I'm going to discuss the different types of first contact OT roles. So ones that have been included in the R's reimbursement scheme. We're going to talk about the NHS England First Contact Practitioner Roadmap, and then how we at NATH can help you, and some useful contacts for onward management. So first of all, one of the first contact roles, we have mental health occupational therapists. So these are clinicians that are based in primary care. And the aim is that if a patient contacts the surgery, contacts reception, and says they have a mental health concern, so it can be acute distress, it can be that they're in crisis, or it could be things as basic as I'm not sleeping well, I can't cope with work at the minute, I've got low mood. There's a complete range that these mental health OTs can see, but the aim is instead of seeing a GP, they go straight to a specialist, so a mental health OT, where they can get that broad assessment. And then some of them have some follow-up ability, so kind of 2 to 3 slots, but they can decide if it's short-term management that can be completed in primary care. They can decide if it needs any secondary care service or signpost to the community, or if it does need escalating to kind of crisis or hospital management, so that these clinicians have that broad skill to be able to assess risk. As I said, they can provide short-term work. So some of our clinicians work by providing workbooks. They can go through strategies, some intervention, or in some PCNs, there are health and wellbeing coaches that support with kind of that onward group work after having seen a mental health OT. They don't just look at obviously mental health itself, they look at the whole person, so look at occupation as the name suggests. So this profession is able to write Med 3s. So if for any reason someone doesn't feel that they're able to work, this is something that they can issue without having to go to the GP. So it's not only saying that they're not fit to work, but they're also to look at amended fit notes. So ability to say, and this is where occupational therapists are very good at saying, you can work if we put this in place. So we know with the research that actually the more we can keep people in work, the better. These clinicians are very skilled at looking at what we can put in place to make it as easy for the patient to stay in work. So this is an average day for a mental health OT. This can vary PCN to PCN. So what you can see on the left, roughly, and again, this is all, each PCN works slightly differently, but this was one example. So they look at more the new patients, you'll see as this kind of light coloured purple, and a receptionist will just book in with what the patient's concerned about. They have the ability to follow up slots, so it could be that looking at reviewing medication to a therapeutic dose. Just to note, OTs aren't able to prescribe, but if the GP is prescribed, they can work with the patient while they're reaching therapeutic dose. They can do, as I said, follow-up appointments to look at workbooks, looking at strategies short-term, or again, it might be that they have to contact secondary services and do more complex onward referrals. So this, as I said, is an average day. So roughly, the OTs are looking at a 45-minute for a new appointment, but that's everything from getting the patient in, completing the assessment, to completing onward referrals. And then follow-ups 15 to 30 minutes, as I said, depending on kind of the nature of the follow-up. They are able to discuss with other members of the primary care team. So it might be that a patient comes in talking about their mental health, but obviously they've got, say, like blood pressure concerns. So they've got the ability to ensure they get to the right person within the primary care team. So a day in the life. Again, this is just an example of what one of our clinicians have seen on an average day. So there's a range of ages. So within the PCNs at the minute, they only see 17 and a half years old and upwards, but that's very PCN specific if you have OTs with the skill set to be able to see pediatrics. So otherwise, it's a very wide range and a very wide spectrum of kind of pathologies or conditions that do come in. So this is, for example, grief, poor coping. That's what a receptionist might write, but otherwise the OT is a complete new case. Again, this is one PCN. The OTs haven't standardized their kind of inclusion exclusion service criteria. So this is very much to what clinician you might have in your practice and what provision they have to what they can and can't do. So as I said, occupational therapists can write Med3 since July 22. So because they're HCPC registered, that allows them on System 1 to be able to write fit notes or Med3s. So roughly the inclusion criteria is kind of any mental health condition, as long as they're not under a secondary care service, sleep issues, motivation, confidence, drug and alcohol misuse. So again, they wouldn't do long-term care, but they'll be able to guide them to make sure they're under the right service. So things they do not see, as I said, is pediatrics in this area, but again, at different, depending on your skill set, you might be able to see pediatrics. They do not prescribe. Okay, so that's where it would have to go to a GP if it's a medication. However, a bit like other allied health professions, it might be that if it is depression, they might value having an appointment with an OT first to have a look at the whole strategy and that holistic management, not just medication. So if it is very adamant they only want medication, that would need to be a GP or a pharmacist. However, what we would normally suggest to care navigators is to offer them an OT to say, let's have a look at the whole picture. And if needed, the OT can speak with a GP to say if a medication might be valuable. They don't do specifically blood pressure. They don't do bloods or investigation in that respect. But if they feel in need, they have the ability to, if it paints the picture. But that's not what their role is. Not able to section. That's where you would need a GP. If patients are open to secondary care services, it's not really a first contact nature. And then the mental health OTs are not physical OTs. That's where there's quite a difference between the two. So that's where it would need to go to your local reablement service. And patients in mental health crisis, it depends. So that's where if you've got on the day embargo same day slot, that's where it might be relevant. But obviously if a patient's saying that they've got a harm to themselves at that moment, then they need to be advised to the local crisis services, not to wait for what could be the end of the week to be able to see the mental health OT. So that's very much on your criteria, but otherwise we only say mental health crisis if you have the provision in your service to be able to do same day assessment. Any questions on that before I move on? So the next type of first contact OTs, we have more the physical OTs. So at present, they're currently working in care homes in Nottinghamshire. They're able to complete holistic assessments in nursing and residential homes. So they work very closely with the nursing homes or the homes team. They provide, as I said, that holistic assessment. It might be the home will say, we're concerned patient X is having falls, or concerned that they might have a UTI. Your care home lead might do an initial assessment and then hand over to the GP what is required, as opposed to a GP having to come out to every patient where there's a concern. So their job is to reduce GP workload again by doing a lot of the assessment and then finding out what the GP needs to act on. So for example, we've got OTs where the patient's having a fall, they will do that full assessment. They might identify that it could be related to adverse effects from their medication. It could be that they're having a UTI. It could be changing their diet or loss of weight, things like that. That's where they'll do that assessment. They might write or task to a GP and say, it could be a UTI, we'll get a urine dip, and then the GP would then manage with medication as needed. Or they've started this medication and there was a concern, and that's what they would pass over, as opposed to a GP having to come out and do that full assessment. So the aim is to support any admission avoidance, to allow for a quicker discharge from hospital, and then also to make sure that the patient can stay in their care home, or in some other areas, the first contact OT can minimise the need, or the quicker to be able to go home, and make sure that there's that short-term rehabilitation. So as I said, the care home first contact OTs that we've currently got, this is again not exclusive, it's not an extensive list, but this is the kind of holistic assessment that they might complete. So having a look at general observations, so your blood pressure, SAT, heart rate, those kind of things. They look at continence, they look at pressure sores, what any dietary needs, and then they can make sure, so they don't do that full assessment and management, but they do that assessment to make sure that they end up with the right person or the right specialist. So say with dietary needs, they may then refer on to the dietitian, who will do a more extensive management. So the next stage, so these are our first contact clinicians. Now for OTs, it's pretty new to be first contact. Majority of the roles are in secondary care. Like the other R's roles, that's where what we need to do is some upskilling to make sure they're ready for those primary care skills. So NHS England have the first contact practitioner roadmap. So it consists of 2 stages. So stage 1 is very much that education stage. So each uni, some have MSK, some OT specific, some allied health professional specific. This is where they learn those additional skills. So it might be looking at the basics of pharmacology, ability to look at blood, knowing what the unwell patient looks like. So say like a mental health OT will be very specialist in mental health, but it might be if a patient walks in and actually they're looking unwell, even though they're attending for their depression, is that they've got the skill to identify and know where they need to go to next. Stage 2 of the roadmap is a very placement-based phase. So clinicians will demonstrate the skills within the environment. So they do things like clinical observations, they do clinical examination procedures. So it might be a roadmap supervisor will watch them in a consultation to make sure they're looking at that patient from a holistic perspective related to the primary care environment. Clinicians need monthly one-to-one supervision with a roadmap supervisor who have undertaken the roadmap supervision course. So this can be an ACP, an advanced care practitioner. It could be a GP educator, or as I said, people that have gone through the FCP roadmap course. So this is alongside having peer reviews with their fellow OT colleagues, going to governance meetings, as well as having clinical debriefs. So that might be on the day with the GP that they might have had a safeguarding issue, they might have had a complex patient, they have the ability to speak with the GP specific to that patient at the time. So from a NATH perspective, it's more how can we help you? So we're looking, this is more directed towards PCN business managers, clinical directors, transformational leads. So from a NATH perspective, if it's something that you're wanting to put into place, so to have any first contact OTs, be it mental health or physical, that's where we're able to have one-to-one conversations to be able to support you to recruit, discuss how the roles can fit within your PCN. We have example job descriptions that you can use as a template and then adapt to your PCN. We can support with recruitment and discuss from the challenges that we've experienced and what we can do to overcome. We can discuss template rotas. So you can see on the right, this is what I call like a probation diary. And then we have the final diary, which looks slightly different. So say at the beginning, it's a new environment, that's where they get more initial time. Later on, that's where you'll get more follow-up time, but only the mental health OT could book into it. But it was more to show an example of what we could do. We can support with induction plans to make sure that the OT is integrated into PCN, but also to that wider community. So it's knowing what secondary, tertiary and community services that they've got available to them. And then obviously that clinical integration. So making sure that those skills are utilised within your practice, and also they are getting the support from those other clinical skills. And then also what NATH can do is help upskilling So this includes the NHS England Roadmap, but also with NATH, we have various courses from the training needs analysis to be able to support clinicians in the skills they need in primary care. So this is where we can support with personal development plans. I said we can guide the PCNs from our experience. So for example, this is kind of an example personal development plan. Again, with mental health OTs, that they might be dealing a lot more with menopause patients in primary care, which is not something they would do when they're in an inpatient environment in their previous mental health roles. So it's more in the future. Who are you going to go to? So in terms of any allied health professional first contact role, so especially through the R's scheme, you've got myself and Laura Bryden. So we're both working for NATH to help support. So it's not just the occupational therapists, but any allied health professional that you want to recruit or support with, that's where we're here to help. So be it if you want to ask any further questions about the roles as a clinician wanting to come in, or if you're a PCN or a care navigator wanting to know more about the role and how it works within your PCN. So please, here are emails. You can always ask to book a one-to-one or contact through NATH if there are any other further questions. So just so you know, we have the Grow Knots Primary Care app. So on here, you can get all the information about what's going on, all the online courses that we have. It will give you alerts about events coming up, and then you can keep up to date with anything happening within Nottinghamshire, especially within primary care. So you can download on Google Play and Apple Store. It's just so you're aware, a very handy app to have. And then for any further information, lots of social media to be able to contact us on. So I'm going to stop sharing my slides. And any questions from anyone about anything that we've discussed so far? Perfect. Well, if there are no further questions, we'll leave it there. But as I said, please get in touch via NATH or via the emails. We have all our social media channels. We'll make sure we're putting more about the role. But if that's something you're interested in the future, so not just the OTs, but we also look after the other allied health professionals, so the first contact physios, paramedics, dietitians, and podiatrists within Nottinghamshire.